Is it prednisone or is it Xanax that's causing me to feel this horrible? Hi, I'm Dr. Megan, the Prednisone Pharmacist, and I just got off a consultation with someone who was worried about prednisone withdrawal symptoms. She'd been on prednisone for 18 months, and then she's been off of it for 3 months. And she did a really slow taper, but now she's feeling horrible, and it seems to be getting worse over time. And she's wondering, is this prednisone withdrawal, and is this normal, or could it be something else? So, as we dove deeper into her history, she let me know that she's been taking Xanax this entire time. Xanax is a benzodiazepine, also known as alprazolam, and it also can cause withdrawal symptoms when it's being removed. Both prednisone and benzodiazepines can cause physiological dependence, where your body cannot live without it. In prednisone, that makes you adrenal insufficient. You have no adrenal hormones because prednisone is replacing them. And in benzodiazepines, the benzodiazepine receptor is what is the difference. And so both drugs can cause a withdrawal syndrome that is horrible. And when it comes to benzodiazepines, can actually potentially even be fatal. And it's horrible and not talked about enough. So I wanted to talk a little bit about the similarities and differences of the two different kinds of withdrawal and what to look for if you happen to be taking both. All right. So first of all, I want to talk about prednisone withdrawal. Now, the symptoms of prednisone withdrawal include feeling essentially like you got the flu. So you feel exhausted. You are stuck on the couch. You don't have the energy to get off the couch. You have low energy, fatigue, and you can have low blood sugar and a loss of muscle strength. So your muscles feel weaker. You might have nausea, muscle or joint pain, sleep disturbances, and weight changes. It's often weight loss. And so occasionally you can even get a fever. And so it really feels like you're just sick, but you're not necessarily sick. It might just be prednisone withdrawal. So that's prednisone withdrawal. And then I wanted to refer to a scientific article written by Peterson. And he said that physiological dependence on benzodiazepines is accompanied by a withdrawal syndrome, which is characterized by a sleep disturbance, irritability, increased tension and anxiety, panic attacks, hand tremor, sweating, difficulty in concentration, dry retching, and nausea, like wanting to throw up but nothing coming up, and some weight loss, palpitations, like headache, muscular pain, and stiffness, and a host of perceptual changes. And that's like the way you perceive the world, maybe your vision or your auditory changes. And so a lot of the symptoms of these withdrawal syndromes overlap. For example, the sleep disturbance changes, sweating. I didn't mention that before, but people can get sweating with prednisone withdrawal too. The weight loss, the headache, the nausea, all of those kind of overlap, and it can be hard to tell the difference. And so after talking to this prednisone warrior, to me, it seemed like her symptoms are probably more side effects of taking Xanax, and that potentially switching to either a different benzodiazepine like clonazepam or tapering off might help. And so she's going to talk to her psychiatrist and we'll see how that goes. But for now, I just wanted to let you know that prednisone withdrawal is a really difficult thing to diagnose because it's so non-specific. The symptoms could be benzodiazepine withdrawal, could be prednisone withdrawal, could be COVID, could be the flu, could be all sorts of things. And so it's really nuanced and most doctors aren't looking for it. And so if you're feeling awful, then that's what it could be. It's really tricky to know. But if you're wondering more about prednisone, I have a prednisone checklist that includes the top 7 mistakes that people make while taking prednisone. And it has information in there to help you recover from taking prednisone if you're going through withdrawals. So if you have any questions about that, just click the link below to sign up now to download your very own prednisone checklist so that you know exactly what you need to do so you can feel like yourself again after taking prednisone. Signing off as Dr. Megan, your prednisone pharmacist.